I'm Dr. Ludik from the ORTHOlifestyle Center. Let's have a closer look at the musculoskeletal condition known as kyphosis. A healthy spine has three natural curvatures. The cervical spine has an inward curvature known as a lordosis. The thoracic spine has an outward curvature known as a kyphosis. The lumbar spine also has a lordosis. Kyphosis is a spinal disorder in which an excessive curvature of the thoracic spine results in an abnormal rounding of the upper back. The condition is sometimes referred to as round back or hunchback. The thoracic spine has a natural kyphosis of 20 to 45 degrees. The medical term for a curvature of more than 50 degrees is hyperkyphosis. However, the term kyphosis is more commonly used. Postural kyphosis. This form of kyphosis often becomes apparent during the teen years. It is caused by poor posture or slouching. The spinal curve is typically round and smooth. It can be corrected by the patient when they are asked to stand up straight. Scheuermann's kyphosis. This form of kyphosis often becomes apparent during the teen years. It is more common in boys than girls and stops progressing once growing is complete. It is caused by a structural abnormality in the spine. Usually 3 or more consecutive vertebrae will have a more triangular shape instead of a square shape. This irregular shape causes the vertebra to wedge together toward the front of the spine, decreasing the normal disc space and creating an exaggerated forward curvature in the upper back. The curvature is typically sharp and angular. The back is stiff and rigid. It cannot be corrected by the patient when they are asked to stand up straight. Congenital kyphosis. This form of kyphosis is present at birth. It is caused by the malformation of the spinal column while the baby is in the womb. The curvature typically worsens as the child ages. Pathological kyphosis. This form of kyphosis presents at any age. It is caused by structural changes to the vertebral column due to compression fractures from trauma or conditions such as osteoporosis, aseptic necrosis, vitamin D and calcium deficiencies. It can also form when a vertebra shifts from its normal position due to a spondylolysis or spondylolisthesis. Degenerative kyphosis. This form of kyphosis usually presents at a late age. It is caused by loss of the intervertebral disc height associated with aging. Visible signs may include rounded shoulders, a visible hump on the back, dowager's hump, tight hamstrings. Other symptoms may include stiffness of the spine, mild back pain, fatigue, weakness, tingling, numbness of the legs, loss of sensation, changes in bladder and bowel control, shortness of breath and breathing problems. Your therapist will begin by taking a medical history and may ask about your general health and symptoms. The physical examination may include your therapist pressing on the spine to determine if there are any areas of tenderness. The Adams test enables your therapist to better see the slope of the spine and observe any spinal deformity. You may also be asked to lie down to see if this straightens the curve, a sign that the curve is flexible. Your therapist may refer for diagnostic tests such as X-rays to determine the cause and degree of the kyphosis. Treatment plans are aimed at reducing the degree of curvature, prevent further curve progression, prevent further deformity, and to alleviate pain and discomfort. Your therapist should take the following into consideration when putting a treatment plan together: the age of the patient and their overall health, the number of remaining growing years, the type of kyphosis, the severity of the curvature. Conservative treatment is recommended for patients with postural, aging, and Scheuermann's kyphosis of less than 70 degrees. Treatment modalities may include soft tissue therapy, adjustments, traction or mobilization of the spine, stretches for the back and hamstring muscles, strengthening of the core and back muscles, electrotherapy, bracing when skeletal maturity has not been reached. Surgery is often recommended for patients with congenital, medical, and Schwann's kyphosis of more than 70 degrees. Spinal fusion is the surgical procedure commonly performed. If a kyphosis is diagnosed early, many patients can be treated successfully with conservative therapy. Patients with kyphosis need regular physical treatment to manage the condition and monitor the progression of the curve. Thank you for watching. Don't forget to like and subscribe.